Good afternoon, everyone, and thank you for joining us again for another live stream series in our webinars to help answer questions about the impact of COVID-19, the pandemic, and what it's doing to our mountain communities. My name is David Kraus. I'm the editor of the Aspen Times, and I'm the lead of the editor group for Swift Communications, which has publications in Colorado, Utah, and California. We'll be hosting this live stream for about the next 45 minutes, and we are pleased to be joined today by Dr. Glenn Mays, who is a professor and chair at the Colorado School of Public Health. Some of you might remember Dr. Mays was with us for our first live stream back on March 19th as the outbreak started to spread across our region very quickly. In today's session with Dr. Mays, we thought we would check in with him and see if he can give us some updates and address questions about testing, vaccines, continued social distancing measures, and what communities might expect in the coming weeks and months as they slowly get back to business. We've been collecting questions from our readers for the speaker, and we invite you to send your questions on this feed, and we'll get to as many of those in the last part of our webinar as we can. If you are joining us via Zoom, I ask that you do hit your mute button, and if you do have a question, please put it in the Q&A section. Real quick, I'd like to introduce all of the editors in the communities that we serve. Here in Colorado, we have Eli Pace at the Sky High News, which serves Grand County, Nate Peterson at the Vail Daily, Nicole Miller at the Summit Daily News, Peter Bowman at the Glenwood Springs Post-Independent, Lisa Schlichtman is at the Steamboat Pilot-In Today, Kyle Mills is at the Rifle Citizen Telegram, and Josh Carney is at the Craig Press. Over in Utah, our editor there is Bubba Brown at the Park Record in Park City. And in California, we have editors Bill Rozak at the Tahoe Tribune and Brian Hamilton at the Sierra Sun and Grass Valley Union. And then working out toward the Great Plains, we have a few agricultural publications. Rona Johnson leads up the Fence Post, and editors Carrie Statham and Mariah Tibbetts at the Tri-State Livestock News and Farmer Rancher Exchange. I always like saying that one. That's a good one. So our viewers know after this live stream, we will post this Q&A to all the websites that we serve and our social media Facebook pages as well. You can also see the other live streams we've done in the past. And with that, I will turn over the conversation to Kelly Geary-Agnew, who is the marketing strategist for Swift Communications and has been working with our editors on the project. And she'll do a Q&A for about the next 30 minutes with Dr. Mays, and then we'll take some reader questions. Thank you, Kelly.
Great. Thanks, Dave. Thanks, everybody, for being here with us today. I'm gonna real quick let Glenn take just a second to introduce himself and talk about his experience.
Great, thank you for the chance to be with you today. Pleasure to talk through these issues with you. I'm a professor and chair at the University of Colorado, the Colorado School of Public Health. I've spent about 20 years in the field of health services research, health policy research, studying health systems and how to improve their operation and their impact on health. And big focus within that work is in studying preparedness for large-scale hazardous events, disease outbreaks and other events that can affect health status for large groups of people, and we're in the midst of one right now.
Great, thanks Glenn, thanks for being here today. So like Dave said, we've prepared some questions. Please put your follow-up questions in the chat box as we proceed. So like we've talked about, we're kind of getting to maybe some kind of reopening. We're thinking about what it might look like to return to some version of normal, although not completely normal. So as we start that reopening process across these communities that we serve, what are things that people should be thinking about? What are kind of considerations? People are getting out more maybe than they have been in the last 2 months. And maybe what are some concerns as well on the public health side of things?
Absolutely. So this is a very important time as we start to relax some of the strongest social distancing measures. The key thing, the key issue for us is to be able to open up parts of our economy and parts of our society while still being able to slow the risk of disease transmission in our communities. Because the fact of the matter is, most of us still have not been exposed to this disease. Most of us do not have any immunity, a vast majority of our populations. And so as we start to open up, be able to go back to work in some cases, be able to visit businesses and move more around the community. Very important to try to maintain social distancing while doing those activities, including maintaining the 6-foot barrier where we can. If you're in the grocery store or in businesses, a second thing, wearing a mask or some other type of face barrier while you're out in the community. Those kind of strategies will be very important as we return, more of us return to work, return to businesses, and return to social engagement.
Just going off that real quick, is there an estimate of what percentage of people have been exposed? Do people think, like, what's that kind of still potential for more exposure?
Yeah, we're starting to get some rough estimates of prevalence of exposure in parts of the U.S. Very noisy measures. Still a lot of debate about how good our estimates are on that. For Colorado, where I am, our best estimates were probably 1 to 3% of the state population has been exposed at this stage. Even if we're off by an order of magnitude on that estimate, we could be. It still means the vast majority of us have not been exposed and are still vulnerable.
Sure, makes sense. So we talked about this last time you were on, but once again, now that we're getting out and about more and more chance for exposure and coming into contact with the virus, what do we need to keep in mind for kind of minimizing bringing that back home after we've been out in public?
Yeah, very, very important. Still, the basic strategies we've been talking about from the beginning of this pandemic are the most powerful. Hand washing, that's the most likely way of bringing this virus back into your home. Being very vigilant on hand washing as soon as you get back into your house. There's also a lower probability of bringing the virus in through clothing, shoes, coats, that kind of thing. And so it's a good practice as well to kind of change out clothing and those kind of things where you can. But far and away, hand washing is the most important thing that we can do on this front.
Sure, makes sense. And I think it might be easy for people to feel like loosening that up or, feeling like getting more comfortable. And we don't want people to forget about those initial guidelines for hand washing and keeping things clean.
Absolutely.
So masks, you mentioned that it's important to wear masks. It seems like there's a lot of debate about masks and how effective they are and what type of mask you should be wearing. So what are some basic guidelines for what type of mask and maybe different levels of effectiveness or protection that you'd get from different options that you might use?
Yeah, this is an area of concern and some confusion. Our best recommendation, the recommendation from the CDC, our federal public health agency, based on the best science we have now, is that for those of us who are not healthcare personnel working in healthcare settings, is that wearing some type of face covering, a mask, a bandana, is recommended. And primarily that's because it's effective in reducing the likelihood that we, the mask wearers, could transmit the virus to others while we're out in public. That kind of face covering prevents, or at least limits, the amount of the potential for droplets to come out of your mouth and expose other folks, in particular while you're talking. You don't realize that, but as human beings, when we talk, we generate those droplets even if you can't see them. And so the mouth covering, that's the main reason for that recommendation. It prevents that exposure. It's not really going to protect you as the wearer from getting being exposed from somebody else, but it's going to protect you from causing harm to other people that you might be talking with and interacting with. And you don't need to have an N95 mask to do that. Any face covering will help to prevent those large droplets from being transmitted. We're still in an era of having shortages of personal protective equipment for our healthcare workers. And so for that reason, it's not recommended that those of us in the general public try to secure the N95 masks, which are the masks that actually can filter out small particles, including the viral particles that are transmitted. So we are still trying to preserve N95 masks and other personal protective equipment for our healthcare workers. And so that's why we're still in a state of shortage in most parts of the US for those kind of equipment. So it's not recommended to try to find an N95 mask. Just any kind of face covering will work for complying with the recommendation around face covering at this stage.
And is it important that that covers your nose too, in addition to your mouth? Is that the guideline?
Absolutely, yeah. A covering that covers both nose and mouth, that's going to be maximally effective in preventing you from exposing others. Because again, remember, most of us who get this virus, most of us are asymptomatic. We don't know.
Kelly, does it look like we lost Dr. Mays?
It looks like we're still connected on the meeting.
I can still hear you. Can you hear me?
There we go.
We can hear you, Doctor.
Okay. I must have had an episode of low internet. I
think the internet's getting pretty overloaded. All right, moving on. So antibody tests. This is a topic that we're hearing a lot about. Some of our mountain communities invested in antibody testing only to find out that they are not approved by the FDA for distribution, and there's questions about their effectiveness. Can you help us understand a little bit more about antibody tests and kind of what that projection looks like?
Yes, so we are still at early days with understanding of antibody tests and which tests are going to be most effective. The FDA has allowed, under emergency authorization, allowed a lot of these tests into the market now. For many of them, we don't have good information about how accurate they are, and so that's the major problem. We've got there are a growing number of research studies underway right now to evaluate accuracy and to test how we can use these antibody tests to understand disease prevalence. And that's probably the best place to make use of them now is in research studies. Given the variability and given the unknowns about these tests, it's not recommended that we try to use them for medical purposes at this stage or other reasons. Hopefully, in the coming weeks, we will learn more about which tests are more accurate, which tests can be useful, and then begin to think about scaling them up and using them more widely. At this stage, I would, I think the recommendation is to not invest a lot of energy in antibody testing for the general public.
Is there a guideline for like what percentage of accuracy would be targeted maybe by that testing, to where at what point would we be able to say, yes, now it's reliable enough?
Yeah, it's hard to have a single answer to that because partly the answer depends on the prevalence of the disease in our population. Right now, again, we talked about earlier, we think in most communities around the US, we still have a very low prevalence of this coronavirus. That means that tests, antibody tests that have even relatively small levels of error, false positives or false negatives, they're going to be very unreliable when we apply them in a community that has relatively low levels of the virus. And so that's the real problematic aspect, is we get to a stage where this virus is more prevalent, then these tests can be more useful. Or if we find a test that's much more accurate, that is 99% accurate, for example, then that test could be useful even in communities with relatively low prevalence of the disease. So it really is kind of a complicated calculus that goes into what kind of test, antibody test might be effective.
Sure, makes sense. A lot of different factors play into it. So earlier this week, the CDC announced that there are some new symptoms maybe for people to be aware of, and maybe people are looking back, on a few months ago and realizing that they had some symptoms that maybe they didn't recognize before as potentially being coronavirus. Does the understanding of more symptoms or the broadening of symptoms help us to track the virus and kind of better understand it? And maybe we can see more people who had exposure or had it without realizing it and just thinking they had the standard influenza?
It does, absolutely. Having this larger list of symptoms definitely helps us with identifying cases and getting a better handle on the virus and its spread. In particular, because we're still, for the most part, only testing and prioritizing testing for people with symptoms. And so that means recognizing that there is a broader array of symptoms means that we can be better in targeting the testing to those symptomatic people, and that drives our understanding of the disease. Those symptoms are all, expanded symptom list are also, it's also very important in clinical settings and helping medical professionals, again, make decisions about diagnosis and possible courses of treatment. So the expanded list of symptoms really are important from a public health standpoint in understanding and tracking the spread, as well as from a medical care standpoint.
Sure, makes sense. So this is another thing that everybody's talking about in addition to antibody testing, is what is going to happen with a vaccine. What kind of is the process for establishing a vaccine, and what's the timeline? People have said 18 months. People have said they hope that it can happen within a year, which sounds like it might be a stretch. So what are things that are going into the process of creating that vaccine, and how long might we be waiting for it to be available?
Yeah, so this is something, to keep our eye on. This is the prospect of having an effective vaccine, very, very important for the long-term, ultimate resolution of this pandemic. The vaccine development process is quite involved, and it's a rigorous multi-stage research process. Still, I think our best case scenarios are still looking at 12 to 18 months. Best case scenario for when we might have a vaccine ready to be distributed on a wide scale basis. The good news is there are multiple different research efforts underway around developing vaccines using various models. And so those are occurring in parallel. But each of those studies are still going to have to go through this multi-stage process of testing in the lab, testing in animals. We now have several vaccines that are proceeded to testing in humans, but that's still a long process of testing and monitoring before we can draw conclusions about safety and effectiveness, and then scale up production. So it is for sure still more than a year before we'll have a vaccine. It could be longer, depending on whether some of these first vaccines, are failures, and that's a possibility. But the fact that we've got multiple options being tested in parallel is certainly a good situation to be in. But it's not a near-term solution.
Sure. How long does it typically take to develop a vaccine under normal conditions? What would be the typical timeline for another disease?
Yeah, multiple years, 3, 4, 6 years. And That's why we're very fortunate to be in the situation we are now with having multiple research teams, multiple developers testing different vaccines options at the same time, in that we're definitely accelerating the process. We're breaking records in terms of how quickly these studies have gotten to the stages that they are now. We already have some vaccines being tested in humans right now. That's remarkable, given that we just discovered this pathogen a few months ago, but it's still a little ways off.
Is there cause for concern with that accelerated process at all? Is it the chance that something will come to market that's not effective, or is the process so rigorous that that wouldn't happen?
Our U.S. Regulatory system for vaccine development is exceptionally rigorous, and there's no shortcutting those processes. And so there's not a risk of harm associated with the vaccine development process. We're not shortcutting the process. The vaccine studies that are happening now are having to go through each of the gates around proving safety, proving effectiveness. And so for vaccines that come through that process and succeed, we can be as sure as we ever are about safety and effectiveness of what's developed.
Okay, that's good to know. So this is something that's been brought up quite a bit, I think, and it seems like there's still a lot of question about whether the virus will kind of dissipate over the summer months as it gets warmer, and if we should be concerned about it coming back when it gets colder again towards the fall and winter. Is there any evidence for that? Do we know what to expect in that arena?
Yeah, we actually have had some additional evidence from new research come out on this in the last several weeks, particularly around how the virus responds to certain environmental conditions. We do know that the virus's survival in the environment is compromised by both heat, humidity, and ultraviolet light rays from sunshine. And so those are three things that are protective: heat, humidity, and UV sunlight. And so those are viruses typically don't have trouble dealing with colder environmental conditions, but heat, humidity, and sunlight will definitely help. So for those of us in higher elevations, which typically we have a bit more UV exposure, and particularly in the summertime, we have a lot of sunlight. Those are going to be things that will help to contain the virus, and limit its survival on surfaces, for example, outside.
Sure, makes sense. So in that case, is it possible that we'll see a surge or an increase in cases when it gets colder again later in the year?
That's a very real possibility. Again, other similar viruses do have that seasonality with it, and there's still some uncertainty about exactly what generates that seasonal resurgence during fall and winter. It may be related to cold weather. It's probably more likely to just our human patterns of social activity, and that we tend to spend more time indoors as the weather gets colder. And that creates more opportunities for viral transmission. So there is a reasonable expectation for a surge in transmission as we get into the fall and winter months. Not positive, but a real possibility.
Okay, good to know. You introduced us to the concept of contact tracing last time that we had you on, and that's been discussed a lot in subsequent stories. And it sounds like there's still some concern about using this process and really kind of having enough resources available to make sure that contact tracing happens, and make sure that when there are people who've tested positive, that everybody that they could have potentially come in contact with is tested as well, and kind of that whole process. So how has that progressed? Is it headed in the right direction, and what's needed to ramp up the process of contact tracing?
Yeah, we are definitely in the process. Our public health systems around the country are in the process of ramping up capacity for contact tracing. This is going to be an increasingly important strategy to use as we relax some of the blanket social distancing strategies. As the stay-at-home orders start to be relaxed, we start to have more movement in communities. It's going to be increasingly important for us to identify new cases quickly and do the contact tracing to prevent those cases from blowing up into additional hotspots. Contact tracing is a fairly labor-intensive enterprise, and so most of our state and local public health agencies around the country are now in the process of kind of ramping up their capacity, looking at securing the staffing of both trained public health workers, as well as tapping into volunteer staffing where we can to build those contact tracing systems, and then to ramp up the technology, the data systems to keep those systems working. I know in my home state of Colorado, that work of ramping up is progressing and happening at both state and local levels, and that's the case in most other parts of the U.S. And it's likely we're going to be trying to continue to build that capacity as we move further into the year, and as we start to again reopen more parts of the economy and society.
Is there a role for technology to play in contact tracing? Is there, use of smartphone data and things like that can be leveraged to make that a more efficient process?
Absolutely. There are a variety of technologies that are coming into the market, being used, some that have been used successfully already in other countries that we're looking at adopting. South Korea, for example, was a real leader in developing some of this smartphone-based technology. We've had several of our IT companies in the US, Google, Microsoft, and others develop technologies that are being used and tested. So I think we've got an expanding array of those kind of tools to be used. So we certainly will be learning about how best to apply those tools over the weeks and months.
Makes sense. That's interesting. Thank you. All right, Dave, you got some audience questions in the queue you want to get to?
We do have a few. Thank you. Kind of coming in on some questions about masks and also about the easing of restrictions. So maybe we'll tackle some of the mask stuff first real quick, Dr. Mays. You mentioned UV light earlier. Does direct sunlight help kill the virus off of masks? And what should we do as far as keeping our masks clean?
Good question. Yeah, I think UV light will help to reduce virus viability on any surface, and so certainly sunlight would help with masks. I think a better probably an easier strategy is just to wash your mask regularly. Washing it with soap and water is also effective, and doesn't you can do that on a cloudy day as well.
Let's talk about some of the questions that we're getting on easing the restrictions. Joe had a good question, kind of rephrase, and then another one about the reopening, Dr. Mays, and that the idea of the herd mentality of if some few people have gotten it, should we just get more people out and protect the vulnerable and the sick? The idea of the herd mentality versus the slow opening, what's the difference there as you guys see it?
Yeah, the concept of herd immunity is an intriguing one. The problem is to really be protected through herd immunity, we have to get the disease prevalence up to probably 60%, at least 60%, 70% of the population. That's going to take a really long time in most U.S. communities, because in most communities, our best estimate is that we're down in the single digits of prevalence. Colorado, maybe 1 to 3% of our population currently has the virus. We don't want to wait that long to be protected through purely herd immunity. And so that's why all our models really are in agreement on this. A better strategy is to try to maintain social distancing even as we open up the economy and get back to work. Maintain social distancing as a way to prevent spread, and that'll get us farther out in time until we can start to bring online things like new treatments and ultimately a vaccine. Getting to herd immunity is likely to take a much longer time, and we'd have to incur a much higher mortality rate to get there.
What would that mortality, just follow up, what would that look like, that mortality rate in your guys' math and extrapolations?
Yeah. Well, again, we've still got a fair amount of uncertainty about the estimated mortality from this virus in the U.S., but still, best estimates are it's substantially higher mortality than other kinds of viruses. We're still talking about in the 1% range. 1% in a country of 330 million people is a lot of people. We don't want to go there if we can avoid it.
Some more questions about reopenings, kind of in phases. Maybe you have some ideas on what it looks like. When do you think restaurants will be able to reopen for in-service dining? Kind of where does that fall in that? And then also, what about lodging? When hotels and that kind of that industry start opening up?
Yeah, I think for ultimately the policy decision-making authority is in the hands of our governors as well as our local elected leaders in cities and counties. I think we're going to see a growing number of jurisdictions start to open back up those kind of facilities, in a matter of weeks, but with a strategy of trying to still maintain social distancing within restaurants, limiting capacity of restaurants and other locations, and using, again, strong hygiene practices in lodging and other areas. So I think we're going to see more of that opening up over this next month, particularly for locations that have gotten a handle on the first wave of the virus. We're starting to see reductions in new cases, and for places where hospitalizations in particular have gone down, and so we've got more slack in the system and no longer concerned about overwhelming our hospitals. And so a growing number of jurisdictions are in that situation now, including in Colorado where I live.
And then a follow-up on that one. What about airline travel? What do you see airline travel ever getting back off the ground? What kind of time frame, especially in a tight confines until you have a vaccine? What does the return of airline travel look like in a timeline there?
Yeah, well, I think that we're also going to have to figure out a way of getting that aspect of our economy and society back working as well. Again, thinking about, and I know the airlines are working on these strategies in maintaining hygiene and social distancing within an airline. So I think we're likely to see more travel, but while maintaining more space between passengers. For sure, wearing masks, both for employees as well as customers in those settings. Those are the kind of strategies I think we're looking at for airlines in other forms of public transportation that we all depend on.
A couple more on the mask and then one on vaccine. And I think, well, we'll let you get back to your busy day, sir. Why do some people feel like they don't need to wear a face covering when they're out hiking? I don't know if that's a philosophical question you want to get into, but people outdoor recreating, should they still be wearing a mask, I guess, or what's your opinion there?
Yeah, I think it's still important because, again, the mask is going to prevent your risk of transmitting disease to others. And so even when we're outside on the trail, we're going to likely be encountering other people. And so, it's an effective practice, and it's one that's really important to engage in. And it's not that hard to do, to remember, to bring a mask with you when you're on the trail or outside.
Here's the last one on masks. Stephanie asks, why does everyone say a mask is not protecting you? Isn't it somewhat?
Yeah, the best research suggests that it's generally not that protective for the person wearing it, and primarily because viral particles, if they're in the air, they can penetrate the most mask material, unless you've got the high-powered mask like the N95 mask that we're preserving for healthcare workers. And so, for most masks, it's not preventing viruses from getting to you, but it's preventing these larger droplets that come out of your mouth or nose from getting out to other people. So it's really one directional protection. It's protecting the people that you're interacting with.
All right, I think we have time for one more question. On the vaccine front, Dr. Mays, you said on a best case scenario, probably 12 to 18 months on a vaccine. What is the final element or the final piece that makes officials say, okay, this vaccine is good to go?
Yeah, ultimately, it's a determination by our U.S. Food and Drug Administration, and looking at the research from that's been tested on the vaccine, proving safety and then proving effectiveness, that the vaccine actually generates the immune response that is protective against the disease. Once the FDA has reviewed those research results and agreed they're valid, then you get the FDA clearance to begin manufacturing and marketing.
Very good. Well, Dr. Mays, we can't thank you enough for coming back for another edition of our live streams. I'm glad we didn't have any crazy technical issues like last time, but we got through this one pretty well. So thank you again for your time today.
Thank you for having me.
Just a quick reminder, we will have this video available for replay on all of our local news sites, web pages for you to watch and share, along with the other weekly live streams that we've done on personal finance, unemployment. We will be back next Thursday with another live stream, and we are hoping to take a look at education and how the school year is finishing up and the challenges that our kids are having getting through this end of this school year. I am David Kraus from the Aspen Times, along with Kelly Geary Agnew with Swift Communications. We thank you for joining us for another live stream today. Stay safe and stay healthy.